Welcome. I'm Matt Carmichael, editor of What the Future, and head of the newly launched Ipsos Future and Foresight Lab. And today, we're talking about the future of wellness. I'm going to start this webinar with one of my favorite words. It's a totally wonky word, kind of a mouthful, and I wish I had an AI of James Earl Jones that would just read it in his voice. It's also a word that summarizes a dominant, recurring, and inescapable theme in What the Future. The word is bifurcation. To me, it implies being on different ends of a spectrum without necessarily being opposed, like polarization, which is a relevant word often too. You can be on opposite ends without being in tension. And don't worry, we'll have plenty of tensions to talk about as we go today. On one hand, you have a proportion of the population who is very concerned, in tune, and working proactively on all aspects of health and wellness, from diet to fitness to mental health and mindfulness. But on the other hand, there's a swelling epidemic of diabetes, obesity, and addiction. We'll talk about this and much more as we go. But first, I want you to imagine something. So imagine it's 2028. The continued waves of the pandemic have strained the healthcare system for some more than others. But increasingly, people are taking their health and well-being, their wellness, into their own hands. They get encouragement from social media, from friends and family. They get nudged with sticks and carrots by everyone from pharmaceutical companies to insurers to employers who help pay for that insurance, to the best behavioral science that tech companies can utilize and commercialize. In this world, our devices work together to collect data and customize ways for us to optimize our foods and fitness across a range of physical and mental measures. Wellness is a fad, a trend, a religion, a way of life, or even just a boring part of everyday reality, depending on whom you ask. And yet, it's out of reach for many, economically or logistically, or both. And tensions push and pull us along to the plausible future. And while it's a plausible future for some, it's not a plausible future for everyone individually. Some have high barriers to being healthy, as we'll discuss. Or perhaps, for reasons we'll also discuss, they just don't buy into all of the tech solutions, either the gadgets or the science. But how did we come up with this mini scenario? And how we'll know if that's where we're headed? Let's dive in. So in today's episode, which we've treated as sort of a podnar, we're going to talk about how we do the work of creating a What the Future. We'll walk you through all the steps. We'll take you through all of the data. We'll talk to all of our experts. And in the end, you'll see how we see the future of wellness and how that all comes together. This is What the Future. So here's our agenda for the day. We're going to start by looking at all the things that wrap around the future of wellness itself. Then we're going to dive into each of those different areas on our map, which you'll see in a moment. We're going to talk about the lay of the land. What does the world look like in each of those areas? We're going to think about the tensions, the opinions that underlie how we'll absorb the future and all those changes. And we'll think about what the world looks like based on our current state of being in regard to those tensions. We call that the plausible ports. Then we'll think about, okay, take one of those tensions, and what happens if we slide that bar one way or the other? If we take that tension and that movement as a waypoint, which different plausible port or plausible future might we be aiming towards? And then we're going to introduce you to an artifact from the future. When Kate MacArthur, What the Future's deputy editor, and I sit down to start thinking about an issue at the very earliest stages, We want to think about not just the future of our topic, but all of the things that will drive that future. And so we've created, and we now actually include in the issue, this handy-dandy territory map to show our work and show our thinking in terms of what we think is going to shape the future of, in this case, wellness. We think that some of the dominant industries around it are the healthcare industry, obviously, the food industry. We'll think about consumer behaviors, the environment, consumer goods, and demographics. So in the healthcare industry, we have everything from actual pharmaceuticals to healthcare providers to caregivers in the caregiving industry. Something you'll see also pop up in next month's What the Future Aging. In the food industry, we think about how nutrition and supplements and sweeteners and natural and health foods all play into creating more wellness. We'll think about the desire to have a healthy lifestyle. We'll think about behavioral and mental health. We'll think about fitness. And obviously, we'll also be thinking about the bifurcation. The fact that there is this chasm between living healthy and not, and the things that go into that, like the healthcare system itself. We'll think about the environment and the world around us, how climate change is going to impact the way we live and how healthy we can be in that world. We'll think about consumer goods, personal technology, apparel, fitness equipment, and we'll think about the big driving demographic trends that play into all of this, the generational dynamics, diversified population, and gender differences in terms of how we view things. So what does that world start to look like? In the US especially, when you talk about wellness, you have to start with the healthcare system itself, right? There are no shortages to talk about in terms of the system, especially since only 36% of 18 to 34-year-olds say the system works for them. But since we're focused on wellness broadly, we wanted to approach this from the standpoint of access and equity. Healthcare and equity are two things that seem like they should go hand in hand, and yet they often don't in the US. The health providers, which includes doctors, nurses, pharmacies, insurance companies, nonprofits, government agencies, they're constantly merging and evolving, but they don't always work together or recognize each other. And many still rely on historically biased science. How should these organizations work together to improve the system so that it better supports our individual health? Kate MacArthur spoke to U. Michael Curry, the Chief Health Equity Officer for United Health Group, about several programs they've run. Speaking about the biased science, he said that United Health has a work group focused on evaluating the programs that determine the care to remove any biases. He said that they want to contribute to the science, so they're ensuring the best possible care for all individuals. Removing bias is an important step. And to get the system to work for everyone and improve outcomes for people in the future, care also needs to be more accessible and convenient. A silver lining in the pandemic was that telehealth expanded quickly, providing more access to care for those who otherwise wouldn't have had it. But that comes with its own challenges and limitations. How can care providers adapt to make telehealth and other access points more powerful and available to more people? Here's what he had to say.
One of those technologies that has really shown itself to be beneficial is telehealth, and the increase of telehealth by giving patients an easier option to access care. But there are also barriers that people experience associated with telehealth as well. So we realized early on that many of those vulnerable patients were unable or reluctant because of trust issues to use traditional telehealth. So how could we be intentional and purposeful about removing the barrier and driving better access to this affordable type care?
And so what they did to alleviate some of those barriers is they gave tablets with cellular data to patients in a pilot, and they were able to take 200,000 people and give them care through this telehealth platform. And 40,000 of those became recurring patients, really helping to address issues of equity and inclusion and avoid some of the traditional barriers to healthcare. Telehealth is partially about control, which is the dominant theme here. If barriers are dismantled in the future, will have more to say over how we manage our care within the system and how we monitor our health, diet, and exercise. 3/4, 78%, especially those under the age of 25 at 90%, say they would like to start managing their care using their health plan's website, app, and have that serve as a resource for accessing appropriate care, according to an Ipsos study for Evernorth from late 2020. Many are already using apps and wearables to track various aspects of their health and wellness, and about half have used some sort of virtual care, most positively. Imagine what possibilities augmented and virtual reality will open for care and wellness. David Scowcroft, an SVP at Healthcare of Ipsos in North America, told us that over the next 3 to 5 years, we expect to see more and more digital systems being used in healthcare and generating a mountain of new types of data. Access to healthcare and your interaction with the system is not necessarily something everyone can control, even as many are working to reduce barriers. But one piece of the puzzle you can control is what you eat. Well, that's the theory at least, although it's certainly something many, myself included, struggle with. And part of the problem is that the food that is readily available and least expensive isn't always good for us. But what if our food could be healthier, not just in a general way, but in a very specific and tailored way? Every day, scientists gain more understanding of what food and nutrients work best for a person's unique biology. Food and ingredients found in nature can be synthesized for scale and sustainability and improved. And Kate talked to Naveen Jain, an entrepreneur whose current venture, Viome Life Sciences, is working to develop tech and solutions to deliver just that. Consider a future where a connected fridge talks to your wearable health devices, which talk to devices where you can test your blood or saliva, and they all work together toward a tailored wellness and nutrition plan specific to your body in that moment. All of these smart devices might sound awesome. They might also sound a little dystopian, and that's a tension we'll talk about later on. But if you're willing to cede a little control, or put another way, to have some tools to help you gain more control, that future might be coming. Here's what he had to say.
And our personal assistant called AI is going to be constantly looking at everything that's happening in our life and analyzing and say, okay, we have already ordered the food. Your fridge is already stacked up with the food you should be eating. And we have already thrown out every food you should not be eating, right? Or we will not let you order the food that's bad for you anymore. And it's going to control what you can order.
He's already seen a future where all of these things can work together. And we're getting closer and closer to that. But really, how much does your diet impact your wellness? And in what ways? The truth is, we're still figuring that out. One aspect that is gaining importance is gut biome. I can see some of you out there nodding sagely, and others are looking at me like, I'm sorry, what? And no, you don't need to cover your camera. I can't really see you, but I can imagine. Anyway, gut biome refers to all the microbes who live in your digestive tract. And Simone Pyle studies this for Unilever to help develop food and products that can lead to a healthier gut, which in turn leads to a healthier you in a variety of ways, from mental well-being to sleep to healthy aging to immunity. Sleep and wellness are so integrated that Sleep Number is the official sleep and wellness partner of the NFL. But again, we're still learning. She told us we haven't discovered all of the microbes in our gut, and there's no clear blueprint for the ideal composition. So we still need to learn more about the ecosystem and how it works and the function the microbes have, plus their role in many aspects of health and wellness. Let's dial in on the mental health aspects for a moment, because you can't have wellness if you're only looking at the physical side. Mental health is the second-ranked health concern in the U.S. and third in the world, according to a recent Ipsos Global Advisor survey. We have more tools at our disposal now than ever before to manage our mental wellness, and greater understanding that it's connected to our gut health. Managing sleep, nutrition, exercise, hydration, therapy, and medications, following advice from a functioning healthcare system, can put us in a great place to be holistically healthy, says Dr. Uma Naidu, who founded and directs the first hospital-based nutritional psychiatry service in the United States. She also hopes that technology and advances in research can lead us to a future with more personalized care. She thinks we should focus on understanding dosing of foods. She says, Nutritional psychiatry is not yet at a prescriptive point. We're not at a point where we can say, eat these 3 blueberries, 4 almonds, and 2 carrots. But she thinks that research is taking us in that direction and understanding the amounts of food we should be eating for a certain effect. Part of the issue, as with all discussions of mental health and wellness, is the willingness to have the conversation in the first place, which different generations view differently. Younger generations, for instance, are far more likely to visit or consult with mental health professionals than older generations. When we spoke about these things, she thinks that the media and the healthcare system all play a role in education, and that education can help frame and help destigmatize and help lead to better conversations we can all have about mental illness and mental wellness. She sees some hope.
It's also the responsibility of scientists, physicians, media experts, media outlets to put forth accurate educational content. And I think it's a powerful bridge to bridge that chasm between different demographics and people who need access to information and those who are providing it. And I think the media has to be included in that. As a psychiatrist, I feel the increased awareness of mental health conditions and the resources that are available is something that I do find encouraging. I think that people are maybe the slightest bit more open to hearing about a less stigmatized version of mental health.
These days, Americans on the whole, like most global citizens, recognize that mental well-being is a strong component of our overall health and wellness. But younger generations, even before but more so since the pandemic, are languishing. Yoga, formal therapy and medications, apps like Calm and Breathe can help, but how will we integrate all of these into our daily lives' wellness practices? And how will a greater understanding of these issues impact our overall wellness in the future? We checked in with Jennifer Berg, a director in Ipsos's U.S. Public Service Affairs line. And she says, in healthcare especially, we talk about whether mental health is treated as importantly as physical health. We're measuring point-in-time check-ins, but we're also looking at resiliency on how people are able to bounce back versus those who get stuck in their problems. As I said, we're going to go kind of around the territory map. And as we slip into the environment, we have to kind of ask this question. Climate change and pollution are 2 obvious environmental drivers of our well-being. We see that concern in our surveys, even if we don't see as much action on them as is needed to alleviate these global threats. Our built environment, the roads, layout, buildings, those currently work against us, and in ways that exacerbate inequality in our health, that bifurcation. Yet, the built environment can evolve from a problem to a solution and/or into a means of coping with a changing climate landscape. For instance, we know that walking itself is healthy, and even healthier if used as a replacement mode of transit from sitting inert in polluting cars, regardless of whether we drive or they drive themselves. But does where we live facilitate walking or biking? And does it do so in a pleasant and safe way? Because getting hit by a car isn't very good for our health either. Cities are paying more attention these days, so progress towards a more sustainable and safer solution is possible. And I say this not just as the Ipsos Future and Foresight Lab head, but I also say this as the former editor of livability.com, a site about what goes into making a great place to live. So in theory, self-driving cars will be safer for sharing the road. But will that lead to an even more car-centric built environment? Climate change will play a role in every aspect of our future lives. It will be a recurring topic in What the Future. Coping with heat, potential food and water shortages, a lack of biodiversity, and a whole host of environmental issues will present challenges to our health and well-being. Ipsos data shows that we mostly understand the threat, but we're likely not taking enough action to stave it off in a meaningful way. Nick Boyan, a senior vice president in public affairs at Ipsos, says people globally, and especially in the U.S., report having pulled back on making changes to their consumer behavior out of concern for climate change. That could be a short-term change as a result of the global COVID-19 pandemic, he says, as consumers trade sustainability for safety and convenience. As people start to realize that the climate is impacting their personal health and safety, could that be a tipping point? We've talked a little bit about measurement, but let's dive into that some more. Because one thing that's impacting the future of wellness is our ability to check in on our vitals often in real time. But what do we measure, how often, and why? Lots of companies are trying to answer that with a growing stream of products. Lumen is an Israeli company founded by twin sisters who wanted to better understand their own metabolism to better compete in their chosen sport, triathlons. They've created a breathalyzer-type device that measures your metabolism. Their initial customers were much like them, serious athletes. But they were kind enough to send one to me, not a serious athlete, to try out. And I learned, I think, what they wanted me to, because I was initially skeptical. I mean, I get that I should eat more veggies and get more exercise. Do I really need a thing to tell me that? Wearable health devices have proliferated in recent years, but our data hints that some of the initial enthusiasm has waned. And that was my experience too. Early on, I built some new healthy habits, which the devices helped with. But then I kind of didn't need the device anymore. I think I was a pretty typical early adopter wave. And I think usage and enthusiasm are going to pick up again, because these devices are going to do more in terms of creating recommendations. And those are going to be personal. And ideally, they will also be something that requires less work. I spoke to Mikhail and Marav Moore, the founding sisters from Lumen, via Zoom. Here's Mikhail.
I think this is the trend, that everything will be passive. We don't want to put more effort in those things. I mean, if, we can imagine ideal wearable or ideal device, it will be something that we hardly need to do anything, and it will collect my data, and it will give me recommendation, and if possible, that it will also help me do the recommendation. So this is where we are today, right? We want things to be easy and done for us.
As I said, Lumen isn't alone. It joins a field with everything from Apple Watches and Fitbits to devices that monitor our pulse, blood sugar, and other aspects of your health and vitals. So what could hold back adoption? For one thing, trackers mostly take work, as they said. While your wearable or phone might count your steps or measure sleep, more advanced and detailed measurement requires you to take time, sit down, and collect some sort of sample, breath, blood, etc. And at the moment, you need to collect different types of samples at different points during the day with different devices and different apps doing the analysis. This is kind of like active tracking that requires building habits and routines, which are often hard to do and harder to keep up. Gil Blander is the co-founder and chief scientific officer of Inside Tracker, which for more than a decade has helped people optimize their health and tracker data, DNA analysis, and collection of biomarker blood samples. He sees a future where this process will get simpler and easier, but might still need at least some active steps from users. This could all greatly help adoption. Here's how he sees some of that future playing out.
In the future, we'll have maybe a machine at our house, and there are already some machines like that you basically can prick your finger and run 12 to 15 biomarkers in 2 minutes, and then it will go to our server and will tell you, okay, today you shouldn't exercise, today you should eat that, and at noontime you should take a nap for half an hour, and then you will be completely all set for tomorrow, for the night.
Okay, we're going to pause here because I think he just said I should go take a nap. So let me get on that and we'll pick the webinar up in, I don't know, half hour, 45 minutes or so. Sound good? No? You think I should keep going? Power through? Grab a granola bar or something? All right. So for the most part, everything I've been talking about in the last while is about the ways that the future is going to enable our continued ability to take many matters into our own hands, or at least develop a more real-time and ongoing understanding of our current and future condition. But is that enough? And will all of these tools, which aren't necessarily cheap, nor covered by insurance, if you even have insurance, will they all be somehow available for everyone? How does the individual fit into the health system, and does that work equally for everyone? Kate talked to Dr. Jonay Khaldoun, Chief Health Equity Officer of CVS Health and former Chief Medical Executive for my home state of Michigan. She talked about how there are valid alternatives to the healthcare system, especially as the system itself works better for some than for others. That's something we see reflected in our data, and it makes sense. If the system isn't working for you, or doesn't reflect your views on what the system even should be, you'll look elsewhere. How should the larger healthcare system take the lead to remove structural barriers to optimal health? She contends that it's hard to achieve individual wellness if the system or broader social systems aren't supporting you. Do individuals even have a role to play? Here's what she told us.
they do have a role to play in being healthy as possible. But I want to emphasize that it's easy to sit and say, well, why don't you just eat better? And then you wouldn't have your diabetes, or you wouldn't be obese. But again, a lot of these issues with health are not about individual choices, particularly when you're talking about health equity. They are about systems. If you are homeless, if there is no reasonably priced grocery store within 20, 30 miles of your house, or there is one, but it's 5 miles away and you don't have a car and you're stressed and you're worried about walking outside of your house, how can we, and if you don't have a job, you don't have insurance, how can we reasonably expect someone to appropriately manage their diabetes and be healthy?
She says the healthcare ecosystem needs to better research and measure how different populations are interactive with and faring. She says if we could focus on outcomes and understanding our customers, our patients, and those non-clinical social determinants of health, that would make a lot of progress. So wait, we need better measurement for ourselves, and that's coming. And we need better measurement within the system. It's like the future involves research and data. And as Dr. Curry said earlier, it requires looking at that data without bias. Because in an ideal world, every patient would have the same positive experience where the system and their providers treated them with dignity and respect. But our current data shows that many, especially many women and those in marginalized communities, often feel that their concerns aren't respected by the system. Cynthia Pelayo, a vice president in the Ipsos U.S. Public Affairs Service line, sees potential in the data. She says, these numbers in the chart show us we still have some work to do. But as Dr. Khaldun says, measurement allows us to see where there are gaps and work to address them. So there are systemic tensions within the system. And there's a tension between how much we can control as individuals and how much we need to rely on the system. In a previous What the Future, we talked to Dr. Sandro Galea, the Dean of Boston University's School of Public Health. He talked about how Americans on the whole, and our data backed this up, underestimate the importance of governments and policy in our health. He said step one in having healthier outcomes is for us to, quote, govern for health, well ahead of creating consumer demand for health. But I want to talk more about tensions for the next little bit. In our editorial foresight work, Kate and I identified 4 tensions we think play a big part in the future of wellness. These tensions are a useful device for thinking about the future because public opinion can drive innovation, or the receptiveness to innovation, and it can drive policy. Tension 1. Do we want privacy or personalization? In many ways, this is the tension that shouldn't be a tension. We should be able to get the customized benefits of a wearable, for instance, while also knowing where the data is and isn't going. There are benefits to sharing the data with insurers, etc., because collecting data at all on your own tells them something. When we talked to Michal Moore from Lumen, she said, if you're engaged with your health, you're probably going to be healthier. But that can cut both ways. All the data can demonstrate that you're not taking care of yourself. People have good cause to be skeptical of the benefits and the risks. And we see that in our attention data. A solid majority want to control who has access to their health data, and a plurality agree that they would like more customized recommendations. Currently, that's usually a trade-off to be made. Will that be the case in the future? Tension 2. How do we balance between care and cost? There's a saying that you can have your health, your family, or your career. Pick 2. That's a true tension today, as you see in the data. There's no clear winner in terms of what people prioritize. Health beats budget for many. In another survey question, health beats time by almost the same 60-40 ratio, but time and money are split 50-50. Now imagine a world, like in many other countries today, where people don't have to make that choice. Expansion of telehealth could help manage that balance between time and cost and equity by removing logistic barriers like transportation to and having to take time off work for appointments and doctor visits, as we saw with United Health Group's example of providing tablets to underserved communities. Tension 3. Organic versus modified and engineered foods. This tension is like many playing out in the US today, pitting scientific advancement versus the traditional and alternative. Or perhaps you see it as pitting the natural order versus tampering. The truth is that most food we eat now is modified by science in some way, whether that's processing, synthesizing, or genetically modifying. But whatever you believe, and wherever you get the information on which you base that belief will cause you to fall on one side or the other of this divide. Currently, half of Americans say they try to avoid modified or engineered foods, perhaps not understanding the extent to which many foods already fall into these categories. These opinions will have very real consequences for how and how well we are able to feed humanity moving forward, especially during the accelerating climate crisis. One area which could be a model is gut health, where science is driving consumer interest, which is driving adoption. Unilever's Simone Pyle said, "These scientific advancements are now feeding into consumer understanding, which has led to more consumers actively seeking health and well-being solutions in food and refreshment products." Tension 4. Equitable access versus pay for access. Today, about half of Americans say the healthcare system works for them, but those who make more than $100,000 a year are twice as likely to say so as those who earn less than $50,000. And this is a future we can all agree on. While Americans strongly agree, 82%, that access should be equitable across race, party, gender, income, and age. We see that agreement. Clearly, that's not what is happening today. One thing to keep in mind is that equity doesn't mean everyone gets the same kind of care. Dr. Khaldun from CVS Health says, "Part of advocating health equity is making sure people have access to the care and services and support that they need, and that they receive it in a way that is culturally responsive to what they need." She continues, "Of course we want people to have access to the highest quality medical care, which oftentimes includes an MD or a specialist, but sometimes it's really about broader support system and services, and we can use non-MD specialists and professionals to have that." These tensions and how they play out will really help determine which of the futures we wind up in. And so we've spun out two potential futures for you. The first is based on those tensions remaining where they are. So today, we live in a nation where people absolutely want to control who has access to their health data, and many also want customized health advice. We prioritize our health over our budgets, but not by much. Many try to avoid genetically modified organisms, GMOs, and overwhelmingly we think everyone should have access to healthcare, quality healthcare, regardless of the ability to afford that care. So what does that future look like in 2028? In one plausible future, political gridlock, or worse, decay, prevents systemic reform in the U.S. Our unmet desire for a better healthcare system leads to further frustration, and people take more and more matters into their own hands in good and bad ways. A bifurcation expands between the haves and have-nots, not based on demographics, but of those who have access to and meaningfully embrace wellness technology, and those who don't. The pandemic was a fulcrum. While technology can undoubtedly provide benefits for health and wellness, not everyone is buying it, literally. Some distrust the health system that provides advice and guidance. Some distrust the companies creating the apps, wearables, synthetics, and modified foods, and other solutions. But as the tech continues to advance, many who can, and yes, that's a huge equity issue, lean into it. They use the products, they follow the advice, and they see the privacy implications as a fair trade-off. It's not just the healthcare system, but people use these tools for their own wellness plans. Their outcomes improve. A subset pushes even further into biohacking through natural as well as tech-augmented means. This is neither dystopian nor utopian, but what if we were able to nudge public opinion? So imagine that one of those tensions shifts, that we move from 50% today who try to avoid foods they don't view as natural. What if acceptance of these things grows? That takes us to a slightly different 2028, one in which this waypoint, which we would track in the future, one in which that has moved. Two factors contribute to this. One is greater transparency, driven by maturing regulation and consumer pressure. The second is a perception that we need these technologies to solve climate problems, as well as improve our own health and well-being. More people realize the connection between their mental wellness, their physical health, and the health of their community and broader ecosystem. Research and development into synthetic food ingredients leads to fewer food shortages, more resilient crops, and even less need to grow many forms of crops and livestock. With a little hindsight, people realize how much worse the pandemic would have been without mRNA and other pharmaceutical advancements. Meanwhile, work continues to reduce barriers to equitable care. But those are bigger problems than a few years can solve, especially since this shift in opinion doesn't change the likely political gridlock. Telehealth is embraced by more patients and caregivers for the conveniences and the way it extends coverage to those whom the healthcare system wasn't serving as well. Either of these two futures we've just read are plausible. The key will be keeping an eye on these tensions and planning for what could come next. The themes you see in both of these scenarios really is what I want you to take away from all of this Padinar. First, we're still learning, but it's more and more clear that all of these things are connected. It's not just diet and exercise that lead to wellness. It's sleep, hydration, mental health, and mindfulness. And sure, to an extent we learn that all in kindergarten, or by watching Gremlins, but the degree and balance of these things is still being understood, and especially the degree to which these things can change from person to person, year to year, and moment to moment. We'll talk about some of that again in more depth next month in our What the Future Aging issue. Takeaway 2 is that technology is making huge strides to help us measure this, customize it, and take away some of the burden from us, helping us build habits and routines that keep us healthier longer. But not everyone sees tech as the answer. And heck, maybe it's not in some ways. We're still figuring that out too. But that tension exists, and whichever way public opinion writ large, and as individuals in opinion sways, will determine how our personal and collective health evolve. And lastly, there's a degree to which all of that doesn't matter, for most anyway, if the system itself is broken. If we don't have access to affordable, quality care, if we don't have access to affordable, healthy food, if we live in places that make it hard or even unsafe for us to walk, bike, run, and get out in nature, if climate change forces us all inside or fills the air with smoke and ash, there's some bad futures out there. We can control what we can control, but that's only one part of the puzzle. Finally, I want to leave you with something new that we're featuring in What the Future, called Artifacts from the Future. For this month, as we think about wellness, we actually think back to a previous What the Future, where we talked about the idea of tattoos, and tattoos that could have biomarkers inked right into them. So our artifact from the future for the wellness issue is a tattoo such as that, where a grandfather, an aging millennial, was having a hard time understanding. Sure, Gramps himself had gotten tattoos when he was a 20-something in the 2010s, but not because a doctor prescribed it. His grandchild patiently explained that it wasn't just art, it was for their health. Each part of the dragon was a monitor. Depending on the colors it turned, depending on the shades of the scales, it told them something different about their metabolism, their blood glucose, and their blood pressure. When Grandpa asked, "Why a dragon?" and not something like a band logo or something that would match their avatar, they rolled their eyes. "Okay, millennial," they said. And with that, we're going to leave you. We'll be back next month, and we'll be talking about the future of aging. As always, thank you to Kate MacArthur, Stephen Geary, who heads our production, and all of the people on this team who have a hand in What the Future. Thanks to our Ipsos experts. Thank you to all of the people who agreed to be interviewed. And thank you to you for reading, for subscribing, and for checking in. You can get this content at future.ipsos.com. And for now, this is Matt Carmichael saying, when you imagine possible tomorrows, you ask better questions today.